Good. Pharmacology. You know what pharmacology is? Yeah, pharmacy. Pharmacology is a branch of science that deals with the action of drugs on biological systems, especially drugs that are used in medicine for diagnostic and therapeutic purposes. What would be diagnostic purpose? Diagnostic. Anybody ever get an MRI? Yeah, they put that dye in. That dye is a drug. And so they'll put that dye in for diagnostic to find out what's wrong with you. All right? What's therapeutic? Stuff that makes the pain go away. We'll talk about that. But yes, it can be. It could be for swelling. It could be for pain. It could be for cancers. It could be for GI problems. Pepto-Bismol. Is that a therapeutic drug? Yeah, it really is. But it's an over-the-counter drug, not a prescription drug. Right? Benadryl, over-the-counter. But it's a drug. Right? So, pharmacology is, plain and simply, the branch of science that deals with the actions of drugs on biological systems. All right, a drug is a chemical. All right, it's a chemical agent used in the prevention, treatment, or diagnosis of injury. Sounds like it's a big chemical athletic trainer, huh? Drug vehicle. What's a drug vehicle? And don't tell me like Impala or 1968 Chevy van. The drug vehicle. All right? Do we know what that is? All right, how about tincture benzoin? Do y'all know what tincture benzoin is? It's QDA, essentially. That's what it is. All right, so you can put a drug in there. So, like compound W, all right? Compound W has something that knocks the wart off, but it's got to be in something that can get it to there and stay on there. So they put it on that QDA, that sticky stuff, and inside of it will be the drug. So the sticky stuff holds the drug onto the wart, which then eats the wart away. So if I look in here, such as on this box of ibuprofen, here's your active ingredient. Active ingredient means what is the ingredient in the drug that does the work. The inactive ingredients are, we need to turn that down. Put it on that stuff. So the inactive ingredient is the drug vehicle. All right. So that's one example. Like if you have a wart, you can put it like compound W, and that will work. What about hydrocortisone cream? Cream itself is the vehicle. The hydrocortisone is the drug. So the drug vehicle is a chemical agent used in the prevention, treatment, or diagnosis that carries the drug itself to where it needs to be. Drug vehicle is a therapeutically inactive substance that transports the drug. A drug is housed in the vehicle, and it may be either a solid or a liquid. Actually, it can even be, it probably even be a gas, such as inhalers. All right? So when I take this, the biggest thing that the pharmacist wants to know is, what is the drug half-life? Okay? So I take this drug, and then this is at 0, and I take it, and it gets up to 100% on here, right? How long does it take to get to 50%? That's the half-life. All right? Because once I get half, I need to take it again. After it gets to half, it's not really that effective. So The half-life is the rate in which the drug disappears from the body. Now, you're either going to metabolize it through, especially the liver, because you watch all those deals on TV and they say, um, your side effects can include blah, 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 blah. But if you notice, like, on those drug commercials on TV, but a lot of them have it to where they say, you need to get your liver checked when you take this drug. Anybody had the hepatitis B vaccination? All right. So you go in and you get a shot. You go in like 6 months later and you get a shot. And then you go in 6 months later and you get a third shot. It's a 3-shot deal. And then at the end of it, you get your blood tested. Or they test your blood as you're doing it to make sure that it's not affecting your liver. You don't have a liver, you don't have Christmas, right? So there's you can get rid of it through your metabolism or excretion, or the combination of the two. All right, let's see here. The rate is the amount of time required for the drug, or for half of the drug in the body to be eliminated. So you need to know what the drug half-life is. What's the drug itself? Well, it's a chemical agent used in prevention, treatment, or diagnosis. Did we not change that? There we go. Pharmacology. I'm going the wrong way, aren't I? Drug half-life. Prescription drugs. All right. Those little deals that come in, we see them all the time. Got to have the little puffer because I got asthma, right? Okay. At what time should a student trainer hold on to that? Never. You know why? Well, one, it's not your responsibility. What's the other thing about it? Yeah, it's a prescription drug. So do I want a child to give their prescription drug to another child? Now, granted, I know you all don't think that you're children, but by the law, it says that you're a child. So do I have one child give a prescription drug? Here you go, child. Hold on to that. All right. So let's go and say that she's got her asthma medication. All right. And then this one comes over and says, I got asthma. And she goes, well, it works for her. Okay, try it. Okay. Pretty much hot water. Okay. Best people for that kid to hold on to it is whoever they're around the most. And I would say, give it to your position coach. They got pockets, right? If they're not there, if it's not them, then give it to the staff athletic trainer. At no time should an athletic trainer or a coach dispense prescription drugs to athletes. It can only be done by a licensed physician. Let me ask you this, though. If we have what's called a delegation of authority, okay? So we have this little piece of paper, and it's signed, and on delegation of authority, it says that we work under the license of a physician, of a doctor. And listed underneath there is taking care of all these modalities and this, that, and the other. And then it says to dispense prescription drugs. Now, is that legal? Yeah, because we're doing it under the doctor's license. The doctor's going to give us samples, is how that would work. They would give you samples, and of course, it's not going to be some kind of crazy narcotic. It would probably just be a anti-inflammatory. But it would technically be coming under the physician's license. But at no time whatsoever, if we don't have that, at no time we're going to play that game. Even if we have that piece of paper, I just assume just not even get into that game and just say, okay, if you need to have prescription drugs, you need to go to the doctor. Okay? All right. OTC, over the counter. Anybody know any OTCs? Benadryl is one. Tylenol is another. Advil. Yes, are they up there? Oh, okay. All right, so an athletic trainer may be allowed to administer a single dose of OTC. So if you'll notice on our physical forms, right? Have you seen that part? This is an optional signature for the parent, right there in the front. is the parent wants us to give them Pepto-Bismol, Tylenol, Benadryl, something that's just a generic type deal that's over the counter. Well, then they have to sign off saying that they agree to it. All right? So if your parent says, "Yeah, you can have this," but your parent says no, don't feel left out. That when you come and say, "I've got a headache," and I tell you, "No, you don't get any." All right? So it's all up to the discretion of the parent. All right? It just says right here, athletic trainers licensed by the state of Texas, employed by Magnolia ISD, may or he is hereby given my acknowledgement and consent to administer non-prescription, over-the-counter, and in parentheses it says OTC, medication to my child, and then blah, blah, blah. So they'd have to sign that. And so when they come in and we ask those athletes, all right, what's your name again? And we look it up. We have, because, with 500 physicals in there, I'm not going to remember everybody who's got it turned in or what is signed off. So, yeah, some state laws won't allow the athletic trainer to dispense any over-the-counter medication, and some school districts will also not allow you to dispense any over-the-counter medication. It's nice, especially because every school district is going to have kids that are in need, and every athletic programs are going to have kids who are in need. And going down and buying the $7.99 generic 1,000 bottle or 1,000 capsules of Tylenol or ibuprofen sometimes just isn't feasible for them. Even though it's $8, that $8 might be 2 nights of dinner, right? Those ramen noodles go a long way. So you're really helping those kids who can't afford that. All right, so school policy also dictates about whether or not you can actually use it. So check, who do you can check with? Check with the school attorney. Put it on somebody else's license. If I check with the attorney and the attorney says, yes, I need to have this in writing and keep that in the file. All right? So check with the school board or look into the school board policy. You can also work to change a policy if you're uncomfortable with your standards, but you better be able better to be able and not give out than not be able and give out. You know what I'm saying? It's better off that you're able to give it out, but you don't, than if you're giving out over-the-counter prescriptions and your school board policy said no. You'll get fired quickly. All right? Parent permission and allergy information needs to be on there. What about aspirin? You don't know anybody who's allergic to aspirin? If you're allergic to aspirin, it can actually probably get to the point to where that allergy can kill you. So if I go crazy and hand you 2 aspirin and you're allergic to it, you're off to the ER. So that's got to be marked as far as their allergies. And we have the allergies up here on the front, which is right next there. So all right, as with your treatment form, you need to write down all of your medications dispensed. All right? And keep that in a nice, safe place. She comes in and says, well, I got some Advil. And I say, no, she didn't. And then she goes, oh, yeah, she did. And then I go down and I see all of my stuff where it's all nice and neat. And we can say, no, you didn't. Okay? As far as like if you get a job that's like professional athletes, you will find times that doctor's delegation of authority, they will keep their medication as far as prescription drugs there. And so when that athlete comes in, he's got some tendonitis going on, needs some anti-inflammatories. So especially when it is a prescription drug, it is certainly got to be written down. Now, let's talk about like football. Okay? Football's pretty violent, isn't it? Football will hand out, the NFL teams, they can hand out some pretty good painkillers, such as codeine. All right? They get done with the ball game, and this guy's got a dislocated finger, or this other guy dislocated his shoulder, or this dude had a grade 3 ankle sprain, and now you got a flight back from San Francisco to Atlanta, so you've got a 5-hour flight back across the country. That doctor's going to be there. Well, he's just going to write the deal and say, okay, I approve that he gets this many milligrams of codeine. The athletic trainer's been holding on to this codeine. They need to make sure that they write this down. All right, everything. Have it on file if a parent believes that you are being negligent, saying given too much. All right, the best way to purchase and dispense your medication. All right, now there's a tube over there, and there's a tube of hydrocortisone cream. All right, you've seen that, haven't you? The tubes. You got one of those tubes where it looks like a toothpaste tube, right? And then there's those itty bitty packets of hydrocortisone cream. The little packets, when we look at it ounce per ounce, cost more than the tube. But here's the thing about those tubes. One, there's so much in there. Okay? So much in that tube, it gets thrown in a kit. The next thing you know, hardly anybody ever uses half of those tubes. It gets stuffed underneath somewhere, etc. And so the little ones, the little ones actually are easier as far as ordering, putting somewhere, and you actually probably use more of it as far as what you bought by using the little ones than what you use with the tubes. All right? So I always think that you need to go ahead and buy the individually wrapped smaller ones. All right? Also, if you're going to use ibuprofen, buy them individually wrapped. Two by well, how many? I think this was by 100. There were 100 in here. All right. Then buy a big bottle, because then if you got a big bottle, then what you technically need to do is get little pill envelopes and put 2 of them in and write on there ibuprofen 200 milligrams each time. I know it sounds crazy, but technically that's what you really need to do, as opposed to just putting them in and saying, okay, here you go. So it's easier than this. This is the easiest way. Cost a little more, but well worth the effort. Also, look at the price of labels and packaging for generic form of over-the-counter. When it says on here the active ingredient, okay? So if I'm able to look on this, active ingredient, ibuprofen, 200 milligrams. So that means that if I give you 2 of these, you get 400 milligrams of ibuprofen. By law, the chemical makeup of this ibuprofen has to be identical to anything else that calls itself ibuprofen. So why would I go and spend $5 more for the same amount of stuff for it to say Advil? I don't think I need to. I'll just buy the ibuprofen, right? That's the same stuff. So look and see how much more as far as buying what it is for generics. Your prescription drugs. Are generics as good as name brand drugs? They're like 50 times cheaper. Are they as good as prescription drugs? They are. By law, has to be identically the exact same compound. All right? So they've only got like 10 years. So let's say that you are the wonderful company of Pfizer and you're the wonderful company of Merck, which are pharmaceutical companies, right? From the time that you get your patent on your drug, you only got like 10 years to get your money back. That is hundreds of millions of dollars to get back. You're paying chemists and you're paying biologists, you're paying people out in the field going and checking trees, plants, venom, animals, etc. That costs a buttload of money. All right? So if I'm spending all of that money, how do I get it back? I have to get it back from the consumer. In order to get it back for the consumer, I'm charging quite a bit of money for these pills. And then, after 10 years, oh, guess what? She can make the same thing that you're making because In the patent office, it has her chemical makeup. Well, she's a chemist. She says, oh, I can make that. I just put this together. Now she can make it, and it costs her hardly anything. What about those drugs you get from mail order? Well, you can buy them online. Just go to Facebook. Well, I mean, I'm not talking like that. I'm talking like mail order. You're cruising along and you go, oh yeah, okay, I can get this. Click. No, not compared to an actual pharmacy that does it online. The pharmacy that sends it to you. But one that's online. Buy these drugs from a Canadian website. They're just the same. They're probably not the same. Okay? There is so much drug fraud that's going on right now in prescription drugs that it is crazy. All right? Like Pfizer has their little blue pill. The little blue pill has to be changed as far as how it looks pretty much every 3 months to keep the counterfeiters on there from constantly being on it. And it's just absolutely amazing of how much money they make. And when tested, over 70% or so is fake. So if you need drugs, go to the drugstore and get what was prescribed for. The little blue pill. Huh? Yeah. All right. So look at the price of the labels and whether generic is as good. Where are we on this? That's okay. All right. So when you're buying over-the-counter medications, you can work with your pharmacist and your team physician to understand the medications that will help each situation. We actually had a pharmacist and a physician, like we talked about how you can take hydrocortisone cream and push it through the skin by using ultrasound. And so there might be times that they want you to do what's called phonophoresis. You've got to go to the pharmacist. He has to actually make the cream with the cortisone and how much cortisone that he wants in it. The doctor does. So talk to your pharmacist and your physician about that. Generics may be cheaper than name brand. Did this jump? No, it didn't. Also, we just said that generics are cheaper, but they're the same. Know your athletes. What are your athletes allergic to? All right. So right there, one of the very first things it says drug allergies. So if they are allergic to something, I don't know that I've seen somebody allergic to ibuprofen, but there are people who are allergic to aspirin, so we don't carry aspirin or aspirin products. All right, but know your athletes and know if they're allergic to something. Since this is always on our phones now, we are able to look that up as we look up whether or not the parent has signed it. Some would be allergic to codeine. Well, not that we would give codeine, but let's say that she got hurt at the softball game. All right, somebody got hurt at second base. On the way to second base, she actually trips over third base and breaks her arm. Yeah, it might be, but you trip. I've seen you running now. So. Anyways, so she goes to the hospital. The hospital wants to give her codeine for her pain. She does not know if she's allergic, but her mom knows. And so we'll check that out, knowing whether or not who's allergic to what. Drug allergies can be fatal. It's an anaphylactic shock, but pretty severe. And keep a list of all athletes with allergies with you for all or on all occasions. NSAID. Matter of fact, if you'll look here, isn't that on here? Yeah, what is that? Non-something, something, something, something. Non-steroidal anti-inflammatory drugs. So you're not using steroids to, now we have talked about steroids, haven't we? There's those steroids that make your muscles bigger, and there's those steroids that make your swelling disappear. All right? The puffers, all right? Like you've seen the COPD commercial that's got that elephant sitting on the old people, right? And they're telling you to get this puffer. It's a steroid that makes your lungs, your bronchial tubes not be so swollen. So that's, but these are not steroidal, okay? So the non-steroidal anti-inflammatory drugs, there's fewer side effects. It's not near as hard as the old stuff that we used to get, Telectin. I think we gave out Telectin, Naproxen, etc. Those things were pretty tough on your stomach. They have a longer duration, and they work on swelling of an injury. So I'm not a big fan like using ibuprofen for like headaches. I would probably prefer Tylenol. But the way that ibuprofen is going to make like that ankle feel better is by decreasing the swelling. You decrease the swelling, you decrease the pressure, decrease the pain. So it actually works by decreasing that swelling. So look on the label and see what the active ingredient is. I'm looking here. Active ingredient, ibuprofen, 200 milligrams. Well, notice how many milligrams, because what about a 600 milligram? Do they make a 600 milligram ibuprofen? Yeah. Guess what? It's prescription. Make an 800 milligram ibuprofen, one pill, 800 milligrams. Exactly. Very good. You can take 3 of them and it would be the same. So talk to your doctor / pharmacist, like on the last slide. Find out what's best for size, injury, etc. So if you're just taking 400 milligrams, if it's 200 at a time, it's non-prescription. If it's 600 milligrams, 800 milligrams in one pill, now it's prescription. So remember that. Why? You can overdose on ibuprofen, but you have to take somewhere in the neighborhood of 16 ibuprofen at a time. All right? You can overdose on Tylenol. Tylenol, what it will do is if you take too much Tylenol, it'll kill your liver. All right? So it'll go in, kill your liver. You've got 2 weeks to turn yellow and think about how dumb you were. And then you're dead because your liver quits. So not a smart idea. All right? Notice the name of the active ingredient. Ibuprofen equals Advil. So somebody says, can I have some Advil? Sure, I've got ibuprofen. All right? That's the same thing as Advil, Metaprin, Nuprin, etc. Ibuprofen. Acetaminophen. We don't buy Tylenol. We would buy acetaminophen. All right? That is Tylenol. You need to know this. You need to know because you're going to be asked specifically, match this with that. Huh? What? Well, it's not an oral exam. I say this last one. Salicylic acid. That's aspirin. If aspirin was to come out today, more than likely it would be a prescription drug. But since aspirin's been around for well over 100 years, and it had already been non-prescription, and people are like used to saying, hey, I need a couple of aspirin. Aspirin's also great for high blood pressure. What was that you were bringing up? Huh? Yes, heart disease. Your blood pressure's high. You know, it's a blood thinner. Okay? So if you're having surgery, they make sure that they say, get off of these drugs. Okay? So that you don't bleed more during surgery, especially the aspirin. Although they will give you aspirin after you're done, so you don't get clots. All right? So, aspirin, neosynephrine. You know that stuff you stick in your nose and you spray up there when you're all snotty? Nasal spray, exactly. All right? That stuff there is called a vasoconstrictor. It constricts your capillaries. That's how it makes you breathe better because then once they constrict, you have a bigger path. All right? Can be addictive if you keep using it all the time. So you turn into a Afrin freak. The girl from where? Nancy Classified? Never heard of it. But at the same time, it's great for nosebleeds. So we don't have it here, but I've worked at schools that had wrestling. All right. Um, take some of those nose plugs, put them in a plastic bag, a little lunch bag thing. Put some Afrin in it or neosynephrine in it, so that those nose plugs are now wet with Afrin. They come off. Wipe your nose with gauze. Throw that out. Put one of those wet nose plugs in. All right. So then it's going to put um, the vasoconstrictor in there. Help constrict the capillaries to help stop the bleeding. So they work pretty good. Blood doping. All right. Fun stuff. Blood doping is when you take blood out of your body. All right. And then when your body replaces that blood and you're back up to being a full tank, you take your blood and put it back into you. So now you've got more blood than a full tank. Why? Now you have more red blood cells. More red blood cells, the more oxygen you carry. All right? So you take out your blood cell, and when your blood volume has increased, you add your own blood back into your system. All right? You increase the number of red blood cells, so it improves your endurance. All right? Can be deadly. Well, think about that. Holy smokes, what's going to happen to your blood pressure? It's probably going to go up because you got too much blood running through your plumbing. Okay? So, it can be deadly with the blood overload, which can result in a circulatory and metabolic shock. Certainly with circulatory shock. But these people will do this for Olympics, thinking that like the cross-country skiers, marathon runners, etc. Not a good idea. So blood doping is not too cool. You know, I don't know what Lance did. What did Lance do? You know? Yeah, he was doing this too. And see, you can probably whip that out to where you pull the plasma off, and then you got just a red blood cell, so that you don't increase your volume so much. Drug testing. Did you know that we do drug testing here? You did that. You knew that. Have any of you been picked to do your drug testing? All right. Drug testing is done at high schools. It's done in AAU. It's done in college, Olympics, all the major professional sports. All right. Did you know what they're looking for? What kind of drug? Huh? Weed? They don't test for weed in the NBA. They test for weed in football. They test for alcohol. They test for human growth hormone. They test for steroids. They test for all sorts of things. But check this out. Do you know that if you take some certain prescription drugs, that they will actually throw out a false positive? All right, especially if you're taking like Sudafed, which is ephedrine. So then Sudafed's for your nose. So some of those, so they have to look at a great big book about what you can take and what you can't take. Otherwise, they'll say, "Hey, we gave it to you. This was on your list not to take. You got popped." So then they'll say, "Well, sorry." So drug testing is performed at many levels. All right, at the high school, you need parent permission. We get parent permission right here on our forms. It says that, oh yeah, I agree to drug testing. Sign below. Thank you. And when I was in one school, they initiated drug testing while I was there. And so they said everybody who comes through to participate in any extracurricular activity will be drug tested when they first start. So that meant the very first year, everybody in any athletics, any FFA, any drama, band, anybody that wanted to do extracurricular activities had to be drug tested. That's a pretty big chunk of change. All right? And then from then on out, all freshmen that came in had to be drug tested. And then they still had random drug testing. Well, we had one kid who decided that he was not going to play football because he's not going to quit smoking his pot. So the reason behind drug testing is, well, first off, is urine test is the most frequently used. It's not very expensive. You're looking at less than $20. All right. If you think that you're going to go in and say, "Oh yeah, it was secondhand smoke. I went to the concert, and unless it's a Willie Nelson concert, I doubt that secondhand smoke is going to be enough over there that's going to be staying in you." They can take that test and be as specific as to secondhand smoke and finding out, okay, you've only got enough to where it says that it's secondhand smoke. It is so specific. Or the threshold that they usually use is going to be high enough to where there's no way that you can say he was around somebody who was smoking. So don't think that that's going to be the case. The reason you do drug testing is to give your athletes or give your students a reason to say no to drugs. Not a reason to say no to athletics, but no to drugs. Don't do it for a punishment reason. Do it for a deterrent to try and keep kids off of drugs. No matter what the test, some athletes will do what they want to do anyhow. Just like that kid I was telling you that said, "I'm going to go and smoke my weed and I want to quit football." Unfortunately, that's what he did. So you have to worry about your associated cost. You also have to worry about your punishment phase. Don't make the punishment so bad that you ruin the kid. All right? You guys are kids. You're all going to say, "Oh, I got to try that." Probably not the best thing for you to do, but a lot of you will. Don't run off. We're going to finish this slide. Positive tests need to be informed to only one person, and that person should not be in the athletic department. It needs to be an administrator higher up on the scale in the school district, probably a deputy superintendent. Don't make an athletic director or a coach be in charge of the Don't make a coach or an athletic director be in charge of knowing who gets it done. The reason why is that she got popped right here. Let's say that she gets popped for it, and her mom comes in and says, "She doesn't do that. You made it look. You faked it out, and you put somebody else's in there because you don't like her." Well, if he never knows and he's never part of the process, then that eliminates all that problem. Positive tests need to be used as a sign for obtaining help for the athlete. I firmly believe that if you probably show up once, you probably need like a 2-week suspension, and then for the rest of your career, you pretty much need to monthly or every time that they do it, you need to be on the list. Let's make sure that we keep somebody off of drugs for a good reason, as opposed to allowing them to be on it and be punished so hard. Tomorrow is Tuesday.